Hello, I'm Dr. John Rosten, and this is my President's Minute. Thank you for joining me for this time of updating with where things are with the California Optometric Association and our profession here in California. So let's talk access. Access to health plans, access to our patients. This is a huge, huge issue. And I wanted to touch base just a little bit on that. We have been obviously focused on our legislative efforts and moving our profession forward through expanding our scope of practice. And that's essential. That's critical. But the valid question is, hey, what is all of this going to do for us if we don't have access to our patients? That's a great, great question. You know, HMOs, that's a word that's been with us for a long time. And PPOs, preferred provider organizations, are something that we deal with on a daily basis. And it's something we've been able to be a part of. We've had some access to those networks. But things are changing. Even as we move forward, things are not going to be as easy, even with the PPOs. And then finally, ACOs. This is a term that's probably new to most of us, which stands for Accountable Care Organizations. So the idea is that groups of providers working together as a team can provide affordable quality care, and also they are held accountable for that quality of care that they provide. So with this history of these organizations' medical models in California, we're seeing further changes, of course, as a result of healthcare reform. In particular, both our Medicaid, your Medi-Cal patients in California, and Medicare patients are now beginning to be shifted into the managed care model. In fact, 75% of Medi-Cal patients in California are covered under an HMO. So as we approach our legislators in terms of our scope of expansion and being accessible for our patients, it's important to understand that there are these limitations as to how these patients will be able to access us through their HMOs. Yes, they can provide medical health care services, but it can be a challenge. We may not be able to be the ones to do that unless we move forward with this whole area of access. So we have to work together diligently to address these access issues. COA is taking the lead on this, especially here in California. We have an expert panel of volunteer doctors who serve on our Healthcare Delivery Services Committee. These are folks that are experts in billing, coding, healthcare reform, and they are diligent. They're every day are moving forward, meeting with representatives from the healthcare industry to be able to open that door even slightly so that we can make further gains in this area. So healthcare plans want doctors of optometry who are able to provide the full range of services. And that's why it is so important that each of us here in California are practicing at the highest level of our licenses. So things like glaucoma treatment, all of the various medical services that we can provide are critical for being able to knock on those doors and be able to gain access to these patients through their health plans. If you'd like more information about the efforts that COA is undertaking, please contact Kara Korchis, our External Affairs Manager, for further discussion and information. So thanks for joining me for my President's Minute. Take care, and I'll look forward to speaking again with you soon.